Hello, hello. Good morning. It is day something of the nursing school mindset edit. We've been doing this for a couple of weeks now. Excuse me. Let me get some coffee here. And today we're talking about pharmacology and why that does not have to be a completely impossible class. So give me a quick thumbs up if you can hear me. I just started coughing. Hopefully I don't cough through this whole thing. Probably because I've had a bunch of coffee this morning and not actually any water for hydration. So let that be a lesson to you. Okay, so just waiting just 1 second. I'm getting my notes together, waiting for that thumbs up to confirm there's no issues. We got it. Okay, thank you, whoever that is. I appreciate it. So a lot of times students heading into nursing school or who are in nursing school who are heading into their pharmacology class are absolutely terrified of this class because all they hear are horror stories about pharmacology. And I just want to, this is a mindset edit, what we're doing in this series. So let's just edit how we think about what this class is going to be like. So let's stop thinking pharm is going to be impossible. Maybe you're saying that because you've simply heard someone else say that. Does not mean that it is going to be true for you. I loved pharmacology. I thought it was absolutely fascinating. And one of the ways to change your mindset about a class is to get deeply interested in the subject. And I always found chemistry, when I took chemistry as, one of my prereqs, which was, I believe the first prereq that I took was chemistry, I loved it. And then I took organic chemistry and I loved it. And there was even a brief moment where I thought, maybe I should be a chemistry major. I was so deeply in love with that topic. But then I took microbiology and I really found that fascinating. And then anatomy and physiology, which I found just incredibly fascinating. So I realized I didn't need to change my major just because I found these other classes fascinating. I really thought they were really interesting. And when I found them super interesting, I was deeply invested in learning. So because I loved chemistry so much, I think that's why I really loved pharmacology. It just really lit up that side of my brain. And I also just love the pathophysiology and how drugs work and why they work and all of that interesting stuff. So if you can get interested in pharmacology, it makes it a little less painful to learn. Okay, so that's just one little quick tip. And then really think about why you have this mindset about pharmacology being impossible. Is it because you've taken it once before and you had a horrible instructor who made it more difficult than it needed to be? Or is it because you just hear other people talking about how difficult it is? So I want you to reserve judgment for pharmacology and any class in nursing school, any experience in nursing school, until you see the situation for yourself. This happens to me all the time at the bedside. I will get report on a patient that I haven't actually met yet. I'm getting report, and the nurse giving me report makes it sound like this is the most difficult patient, maybe with their behavior or just, any part of their care. And I initially think, oh man, I'm in for a rough day. But then I stop myself and I say, okay, I'm going to wait and I'm going to do my own assessment of the patient and of the situation. And I would say sometimes the nurse is right. Yeah, I'm in for a difficult day. But 9 times out of 10, it's nowhere near what I thought it was going to be. I had a different experience because I let myself have a different experience. So I want that to be how you get through nursing school. Don't just assume everyone else's experiences are going to be yours. Pharmacology is no exception. So if you are in pharmacology, or maybe you're having to retake pharmacology, whatever, if you are in it and you're struggling with it, I will say this: do not wait to take action. If you keep doing things in the same way and expecting a different result, what is that? That's the definition of insanity, right? So we're not going to do that. You need to take action. Doing the same things that you did before, that really is the quickest route to having another poor performance or another poor outcome. So you need to identify where things kind of fell apart when you were taking that class and make adjustments. So I like to think of this as applying the nursing process to yourself. So you're going to assess the situation. What did you do to prepare? How did you study? How did the instructor's teaching style differ from your learning style? Like, make a full assessment of the situation. And this applies for every class, by the way, not just pharmacology. And then next, you diagnose the problem. What actually happened here? What was the big disconnect? Maybe I don't learn great from reading a mountain of information in a textbook, but the instructor assigned mountains of reading in the textbook. Maybe I learn better by watching videos or listening. So maybe, you can diagnose and identify where the problem is. Maybe the problem was test anxiety, something like that. So assess the situation, diagnose the problem, and then P is your plan. You come up with a plan for how you're going to do things differently. And then I is intervene. So we're talking through the nursing process here. I is for intervene. You're going to actually do the intervention. And then E is to evaluate. Now you go back and you look and you say, now what worked? What didn't work? Maybe you're more of a visual learner and you had been trying to rely on reading. Well, that's not going to work for you. But now you're watching videos and drawing diagrams and holy cow, that's working for you. So that's a little bit of a tip of how you can use the nursing process to come back from a struggle in a class, or maybe you fail an exam or something like that. Hang on, I'm getting a notification on my computer that pops up at the most awkward times. Okay, so before I move on to the next part, I just want to pop up what Glory says. Oh, you got the Kathy White's Fast Facts book. Yeah, it's awesome, right? So I talked about this, was it yesterday, Glory? I think it was. You'll love this book. It's fabulous. It's just got like the must-know information. I found this book to be really, really critical as I was a brand new ICU nurse. And you know what? I think I'm going to start taking it to work again because I still do that kind of stuff in the recovery room. I just kind of forgot about it until I went through my back. Oh no, that was from that was not from a live lesson. That was from a video I did the other day where I went through my clinical bag I haven't touched in about 2 years to see what items I actually did use. Yeah, that was a good one, Glory. Thank you for that. Okay, so now let's go into prepping for pharmacology and how we're going to prep for pharmacology class. So one of the biggest mistakes, and this is probably the biggest mistake why students struggle in pharmacology, because yes, it is a complex topic, and yes, instructors do teach it in an overly complicated way. Unfortunately, you can't change either of those things, but you can change how you respond to that environment, to this class being complex, right? And a huge mistake that a lot of students make is not doing any preparation ahead of time. They get into pharmacology and they're hit with a ton of information and they don't have that solid background, and yeah, they struggle. So you took your prereqs for a reason, okay? Those are your foundation concepts for all of nursing, especially anatomy and physiology, and I would say for pharm, I don't know if you apply your chemistry knowledge, but it kind of feels like the same type of complex learning. So I would say your what class was that? Chemistry. Sorry, I just had a brain freeze. Chemistry and your anatomy and physiology. Really, really key. So if A and P was a while ago for you, you really need to go back and review some key concepts. So the concepts that are probably the most important to review for pharmacology are the RAS pathway. Okay, this system will come into play with a lot of medications that are aimed at affecting that pathway, and like ACE inhibitors, for example. If you understand RAS, then you understand why and how ACE inhibitors work. You don't have to memorize a ton of things about ACE inhibitors, okay? You already know the RAS pathway. You know ACE inhibitors affect that pathway. Bam. Now you know ACE inhibitors for the most part. And then the other one is the autonomic nervous system. This is definitely a challenging concept for students. It's a complex system. Definitely go back and review the ANS. It's really, really key. This is going to include that sympathetic nervous system, your fight or flight, your parasympathetic nervous system, your rest and digest, and with that, just all the things that come with that, right? So going back and reviewing the autonomic nervous system. And that's because a lot of medications mimic or act on the autonomic nervous system. So when you understand that foundation concept, you're not memorizing as much, you're just simply understanding how and why these drugs work. And then kind of aligned with that are alpha and beta receptors. Go back and review that. Many medications are going to stimulate or enhance or block or antagonize alpha and beta receptors. So if you have a core understanding of what these receptors do, then you'll automatically know basically what these drugs are doing in the body. So a great example is metoprolol, which is a beta blocker, and phenylephrine, which is an alpha 1 agonist. If you know those things and you understand alpha and beta receptors, then you're not memorizing as much. You're just understanding it, knowing it. And then with that, we have cholinergic agonists and antagonists. So go back, find your A&P notes, dust those off, read through these things, and get a firm grip on these concepts. So cholinergic agonists are used to treat things like myasthenia gravis and Alzheimer's disease, while anticholinergics treat things like bradycardia, like the drug atropine that you learn about in your ACLS. Motion sickness, scopolamine, is an anticholinergic, and bronchospasm is treated with a medication called Atrovent. So you don't have to memorize so much. You kind of know how and why they work because you understand the core foundation concept. Okay, is this making sense? And then the other thing I would review from anatomy and physiology are those acetylcholine receptors, the muscarinic and the nicotinic receptors. If you understand the difference between these two types of receptors, then you'll have, again, some key background knowledge that you can rely on to really understand how and why medications work. So those are the key things that, oh, no, there's two more actually. Neurotransmitters, you definitely want to understand neurotransmitters. Having a general understanding of the key neurotransmitters is really helpful for you. That's norepinephrine, that's acetylcholine, that's dopamine, serotonin, and epinephrine. So understanding neurotransmitters, you learned this once before, you can review it and get it back into that active part of your brain again. I 100% believe that you can. And then the final one is endocrine, like the endocrine system, the hormones, and the feedback loops. Many, many drugs are going to have feedback loops and or be, just hormones themselves or act on hormones or enhance hormones or whatever. So a quick review of the endocrine system is really going to help you understand a lot of medications and the disease conditions that we treat. This includes things like TSH and the medication levothyroxine, which is a thyroid hormone, right? This includes like understanding treatments for SIADH or diabetes insipidus or Cushing's or Addison's, and all of that's really going to come in handy. So understanding the endocrine system. Okay, I'm going to pause here and just pop up a couple comments that came in. Sarah used to be so anxious about pharm because of the horror stories, right, Sarah? And a lot of people have been expelled is because of failing pharm. Yeah, so pharm is a tough class, absolutely. Sarah follows up to say, I really took time to understand patho behind the conditions and a method of action, and you've gotten an A on every exam. Yeah, exactly. You have to have the right resources. Thank you, Sarah, for that. That's a great little tip from someone who's actively in pharmacology, just got through that class, is getting A's in that class. It's because Sarah's understanding the foundation concept. She's not wasting a ton of time just trying to memorize drug cards. Like people will buy those drug cards or make drug cards and just try to memorize. You can do that. And if you're a great memorizer and a great recaller of information, you could get through pharm that way. But as soon as you pass that exam and move on, you're going to forget that information. But when you have a core solid understanding of a foundation concept, like Sarah was just talking about, pharmacology just becomes an integrated part of your practice. Okay. And thank you. I love that you said that, Sarah. Thank you so much. Okay. So then a couple things that can make pharm easier. One quick tip is one thing that you could spend a little bit of time memorizing is simply the drug prefixes, suffixes that indicate what drug class they're in. This is not across the board. Not every drug is going to have a definable naming convention, but a lot of the common ones do, like OLOL are beta blockers, OLOL. You see that? I'm dealing with the beta blocker. I'm going to watch the patient's heart rate and I'm going to watch their blood pressure. Okay, now I know the key things I'm watching for. Pril, P-R-I-L, that's going to be an ACE inhibitor. I don't need to memorize every single ACE inhibitor. I just know when I see Pril, I recall the information I've learned, my foundation knowledge about ACE inhibitors and the RAS pathway, and I can answer a bunch of questions and know the key things to watch for so that I can give this medication safely. Okay, so you could take a little bit of time to memorize those couple of little things, and those are easy. That's easy memorization, right? You're not going to expend a ton of mental energy doing that. And then, I would also just highly recommend when you're learning pharmacology, focus on the drug class more than the specific drugs. Okay, so when you learn by drug class, then you can pretty much understand that all the other drugs in the drug class are going to act more or less in the same way. There can be a few differences. I mean, that's why there's different drugs. That's why there's not just one beta blocker, right? That's not why there's just one ACE inhibitor. But for the most part, they're going to have the same mechanism of action. If they're in the same pharmacologic class, and if they're in the same therapeutic class, they'll have the same intended effect. So there are pharmacologic classes, which is going to tell you how the medication works in the body. And then there are therapeutic classes, which tell you basically what it does. So how it works is pharmacological. What it does is therapeutic. So, for example, a pharmacologic class is beta blockers. Metoprolol is a beta blocker. That's its pharmacologic class. So learn what beta blockers do, and then you will understand every other drug that ends in OLOL. But metoprolol is also in the therapeutic class of an antihypertensive, which is going to include all kinds of drugs. It's going to include calcium channel blockers. It's going to include those ACE inhibitors. It's going to include, obviously, the other beta blockers, etc. So different therapeutic classes, drugs will often have, they'll have the same intended effect, but you'll have different drugs from various pharmacologic classes within a therapeutic class. Does that make sense? So you need to understand, as you're learning drugs, am I looking at this drug from its pharmacologic standpoint or its therapeutic standpoint? And when I've got a drug that's an antihypertensive, easy. I know it's going to lower blood pressure, right? So that's just a little bit of a word about drug classes. You will come across drugs that do not have a pharmacologic class. Sometimes we know what a drug does, but we don't really understand how it works. And in that way, you'll see drugs with no pharmacologic class listed, but you will see a therapeutic class listed. And just depending on how your professor is teaching it, usually it's kind of a hybrid. We're going to study beta blockers as a pharmacologic class, and then they may have other drugs that you study as a therapeutic class, okay? So it's just more kind of how it's most often referenced and utilized, okay? And then the other thing I would say is get ahead of the game with pharmacology. If you can do that prep work ahead of time, review some of those core foundation concepts, 100% do that. I will link to my pharmacology success pack below this video. It's got those prefixes, those suffixes, some common pharmacology abbreviations, I believe, just some like little tidbits and tips to kind of get you started for pharmacology. It's by no means an exhaustive resource, but it's just a little free little starter, little success pack that I will make available to you. I'll link to that below this video. And of course, if you really want to dive into all of that background information, you can hop into boot camp, where I go through some of these things in the physiology review section in Crucial Concepts Boot Camp. But if you really want to dive into pharm, I just released a program called Fast Pharmacology, where I teach pharm concepts in 5 minutes or less. It's audio based. It's fabulous for on-the-go studying. I'll put a link to that as well. And again, all these concepts are explained in that program. So those are my tips for pharmacology. Try not to let it terrify you. Be like Sarah. Get that background, that foundation information, and don't let other people's scary experiences automatically make you think that you're going to have this horrible, terrifying experience in pharmacology. And let's see, Glory says, the path that really helps. I agree. It's also important to take other people's experience with a grain of salt. Absolutely, Glory. Thank you for that. I really appreciate that. Alrighty, so what are we talking about tomorrow in the Mindset Edit? Let me just pull that up. that is going to be talking about avoiding burnout in nursing school. This can be a problem for a lot of students. And we'll talk about that tomorrow. One more comment from Glory. A resource I recommend is the boot camp. I always go through the modules in between semesters. Fabulous, Glory. I love that. Yes, a lot of times students ask me if boot camp is just for brand new students. And I say, while I created it for students ideally to go through it before they start school because I want you to be successful throughout your whole program, many of my students go through it at the beginning or in between every semester as a refresh, basically. So thank you for telling me that. All right, you guys, I will see you tomorrow. We'll talk about avoiding nursing school burnout. Bye.